Let's get started. If it is writing sugar, which you can take the proteins. Hello. Only you can drink one. Hi everyone, I'm nutritionist Serra. Today I want to explain your nutrition plans after the bariatric surgery. You should do the first 15 days liquid diet period and then the second 15 days pure diet period, and on your first month you will start the solid diet period. I want to give you some recipes and let's talk about the details about the liquid diet and the pure diet and then the solid diet program. I know you are always wondering after the surgery, will I drink only water or only milk? No, we have lots of things for the drinking and I want to show you which things you can drink it. Let's get started. On the liquid diet period, post-op second day, you will start the liquid diet program. We will come your room. We will explain your diet program just for first 15 days. And at the morning, you can start with the juice, apple or the pear juice, but orange, mandarin, grapefruit, pomegranate and cherry. These are forbidden because they are acidic and they're sour. You shouldn't drink sour and the acidic fruit juice. But only you can drink 100 milliliter because I'm giving you just for the good taste. Because now your body needs to take more protein and you should take a protein for the hair loss, muscle loss and well-being your stitch. Recovering your stitch, the proteins are very important. And you can take the proteins from milk, lactose-free milk, soya milk, ayran. I don't know, maybe you don't know the ayran. This is the Turkish traditional drink, but I will show you how you can make it. And if you want, you can drink lactose-free kefir, meat or chicken soup, and the protein shakes. And we will do it together now. I want to start with the juice. If you want to buy from the market, you please choose the bio one. Bio and without sugar, only the apple juice. I found on the market, this is the organic apple juice. If you want, you can buy from this, but please look the ingredients under the bottle. If it is writing sugar, please don't take it. Maybe you don't know, but you can boil the fruits, which we will do it together now. I'm adding water. And if you want, you can put it apple. One apple is enough for me because I want to add pear. First 15 days, you can be diarrhea and constipation. This is very normal because sometimes our patients being diarrhea because of the antibiotics, and some our patients being the constipation because your intestinal system is not full and you are always drinking liquid things. Because of this, you can feel the constipation, and the pear is very good for the constipation. And also, I will add dry apricot. If you have constipation, you can increase the dry apricot amount. This is a dried apricot. 3 is enough, and we are waiting the boiling. At that time, I want to do the meat or chicken soup, which you can take the proteins. Chicken. Hello. First, I want to put it the chicken. But for the good taste, I will add carrot, squash, leaf of daphne, and 1 apple. The apple takes the soup's smell, and it can be tasty, more tasty. I'm adding water a little bit more. You should put the water until top of the chicken. Now we should wait like 20 minutes because the chickens and carrots and squash boiling time is different. But first we need to wait a little bit for the chicken. I'm gonna peel the carrots. You don't need to peel the squash. You can cut the big piece. You don't need to do very small. And at that time, we can talk about the milk and kefir and ayran. Do you know, after the surgery, you should, first 15 days, you should use the lactose-free milk. The brand is not important, but you should see the lactose-free. We have lots of things for the drinking. Also, we will give to the list, and there is writing breakfast, snack time, dinner, lunch, but these are not important. Whenever you want, you can drink something else. But you don't have any liquid limit, but we have a time limit. You should finish 100 milliliter in 30 minutes. 200 milliliter in 1 hour. You should drink very slowly and very little sips. If you take a big sip or if you drink very quickly, you can feel bad things on your chest and vomiting, and it causes to be leakage. This is very important and dangerous. Please be careful for this. If you don't want to drink lactose-free milk, you can drink soy milk. You can find in every market in Europe and UK and America the soy milk. It's very popular. The color is a little bit more yellow than milk, and the kefir, it's very good for the intestine, and it's include lots of probiotics and a good healthy bacteria. You can choose the lactose free also again, but the kefir is little bit more thick. You should add little bit water for making diluate. That's enough, and I want to add a little bit more water. I told you in the beginning of this video, we have Turkish traditional drink, ayran, but it's very easy for doing this. You can use the shaker for the ayran. I'm adding lactose-free yogurt. Water. You can put it 100 milliliter water for 3 spoons of yogurt. If you want, you can add a little bit salt, because on the liquid diet period, our patients wants to take a little bit salty taste. And so the ayran is good for this. But you have a high blood pressure, please don't add salt. Yogurt, water, salt, and shake it. And the most important thing is on the liquid diet period, the protein shakes, because you will take the high protein from this shake which you needed. On your post-op second day, we will give to you your protein shakes, and there is the 4 flavors. One of them is chocolate, vanilla, banana, and strawberry. Now I want to do the banana. 100 milliliter lactose-free milk, 100 milliliter water more. Fill the whole powder, sign from the half, and put it a half. That's enough, and this half for the next meal time. This is 200 milliliter. You can finish it in minimum 1 hour and maximum 2 hours, because we put it milk, and after 2 hours it can be denaturate. The proteins can be denaturate. So if there is a liquid after 2 hours, please throw it away, because the proteins can be denaturate. The smell is very good. We can add carrots and the leaf of daphne. You can add a little bit salt, but spices, onion, garlic, lemon, tomato paste, these are forbidden first 3 months. But salty is confidence. I did it with chicken. But if you want, you can do it with meat or bone with meat. I want to say you something else. The water is very important for you. If you don't drink water, you feel very dizzy and weakness. But if you drink water, you will feel very good. If you want, you can drink light and warm tea, normal English breakfast or Turkish tea. You can drink it, but it should be warm. But Coffee is forbidden on this period, and if you want to drink herbal tea, you can drink linden or the chamomile tea, but the green tea or cinnamon tea, which is the spicy tea, these are forbidden first 3 months. All your drinks, common feature is everything should be warm, not cold and not hot. It should be at the room temperature. For example, at the hospital, they will give to you the soup, and if it is hot, you should wait for the becoming warm. And the compote can be cold. You should wait again for the becoming warm also. Warm, sugarless, non-greasy. When you look your liquids, you have to see the another side's color. This is very important, and you should drink with very little sips. I want to look my compote. If you see the little pieces on the pot, you should filter it, but now I don't see anything. I can put it directly to the cup. You don't need to finish all the bowl of the compote. When you feel saturated, please stop. Now this is very hot. If you boiled it now, please wait for the becoming warm for drinking. I want to look my carrots and chicken. Yes. If you want, you can drink the plain chicken soup, but I think with some vegetable, it's better for the taste. And also, I'm gonna add 1 apple. Apple gives a good smell. If you can't do your own compote, when you buy from the market, if it is thick, please add a little bit water for making dilué. I first shake it a little bit. Our chicken soup is done. I'm gonna put it to a bowl. Color is perfect and the smell is perfect. Now I'm seeing the little pieces in the water, so I need to filter it. I want to say it again. I didn't add any spices, oil, lemon, tomato paste. But the chicken has also the oil. Now you can see on the top of the water. You should take it out this oil before drinking. If you want to drink it, you should wait the becoming warm. So you can see lots of things for drinking. Please don't be upset. You should and please drink your liquids very slowly and very little sips. The liquid diet is like this. Now we can start other 15 days, the pre-diet period. After the first 15 days liquid diet, you should do the pre-diet period. You will be like the babies. You should eat the blended or mashed foods. We will do it together. Some recipes. I want to start with breakfast because on the pre-diet period, now we have the meal times like breakfast, snack time, lunch, snack time, and dinner. If you remember, on the liquid diet period, we don't have any meal times, but on the pre-diet period, we have a meal time. But at the beginning of the pre-diet, I want to say to you something which is important. You should start to do the liquid and the solid separation. For example, you can drink and eat something else together. If you drink something, you should wait 30 minutes for eating something. And if you eat something, you should wait 30 minutes for drinking something. You can do it together because your stomach is very small and there is no volume for drinking and eating together. I want to start with the breakfast. The eggs are very important because it contains high protein, and every morning you should eat 1 egg whites. At the pre-diet period, you can eat only the egg whites, but on the solid diet period, the 15 days later, you can start to eat egg yellows and the egg whites together. If you are bored for the eating everyday egg and cheese, You can do the porridge some days. You can boil the oat with the milk and then you can add a little bit fruit purees and we can do it together, porridge. If you want, you can do it with soy milk. 2.5 spoons is enough and we are waiting to boil it. Just for the good aroma, I'm gonna add a little bit vanilla essence. If you add too much, it should be very spicy. That's enough. And it gives good taste. Egg is done. I peeled the egg. I'm separating the white and yellow part. If you want, you can give the yellow part to your family, but now we don't use it. It includes high cholesterol. Your gallbladder, when you eat the yellow part of the egg, your gallbladder will stimulate too much gall acid. And so on the pre-diet period, please don't eat the egg yellows. This is very soft also. You can mash it with the fork and that's enough. You don't need to use a blender. I want to use the creamy cheese, but this is a light creamy cheese. Maybe you can find, for example, Philadelphia light cheese, creamy. That's it. It's already done. You can eat this egg and cheese on your breakfast. Maybe you can think, can I feel saturated after eating these? Yes, maybe you can finish this amount. If it is soft, you can mash it. But if it is not soft like this, you can make it greater. If you don't boil it, the oat is solid and milk is liquid. It is not good for the rule, the liquid and the solid separation. If you want, you can mix it. I told you, I'm telling you again, maybe you can finish this amount because your amounts can be changed when you drink before, when you eat something else before. What did you eat and now what are you eating? Your amounts can be changed, all these factors. I want to start to do the lunch and the dinner. Liquid diet period part. We boiled chicken and carrot and squash together. And now I take the leg part from the chicken. I will mash with my hands and then I will put the cooked squash, carrot, and then we will blender it. Or if you want, you can mash with your hand the chicken and you can add yogurt and mix it and you can eat also. But I want to do it with vegetables. On the pre-diet period, please don't choose the chicken breast because it can be thick more than the leg part of the chicken. That's enough for me. Is too much for us. And I'm putting the chicken. If you want, you can add a little bit salt. On the pre-diet period, again, you can add to your meal spices, onion, garlic, lemon, tomato paste, just salt you can add. I think the pre-diet period is very funny. On the pre-diet period, first 1 week you can use only the white meats like chicken or fish, but second week you can start to eat mincemeat. I want to show you the fish. Fish is also soft. You don't need to blender it. You can mash it with a fork and that's enough. If you are working all the day, the tuna fish is very quick option for you. You can also mix with cooked vegetables. For the second week, I'm going to cook the mincemeat and we will do 3 options for the mincemeat. I put it to the pan. I won't add any oil, just a little bit water and that's enough for cooking. This is for the spinach. I'm adding spinach and I will cook with the milk. I want to increase the taste and the protein. And at that time, I'm cutting the mushrooms, which is increase the high protein. You should buy the lean meat. And at that time, I want to explain some forbidden foods like the tomato and cucumber. All the raw vegetables are forbidden, and nuts and bread, rice and pasta. You shouldn't use these three things. And I have the roasted eggplant, and if you want, you can do the eggplant mix with the yogurt and add mincemeat. I will do it for you. I want to show it. I think eggplant. And this is also soft. You don't need to make blended. Mix with the yogurt. On the pre-diet period, always think that if I don't have any teeth, can I eat this meal or not? I mix with yogurt and the eggplant. Oh, it's ready. Our mushrooms, I think in 1 minute it will be done. And I want to add milk a little bit to the spinach. If you want, you can add chicken or mincemeat, but now I want to add mincemeat. I think I'm not good at the serving. It's ready, and we are waiting the spinach. You can see it's already soft. You don't need to blend it. I want to say it again. I can't tell any amount of the portion, but eat very slowly. Every meal should take 30 minutes minimum, and when you feel saturated, stop it. If you're taking a big spoon or big fork, you should stop to use it. You can use the small spoon and the small fork. For the snack times, you can eat yogurt. But now you don't need to use lactose-free yogurt and lactose-free milk. You can start to eat normal, regular yogurt and milk. For the snack time, you can eat yogurt, plain yogurt, and if you want, you can add little bit fruit purees. If you can't use the grater, you can take from the markets the baby fruit purees and mix with the yogurt. You can use the baby fruit purees. Yogurt is solid. Fruit puree is solid. You can mix it. But if you eat fruit puree, you should wait 30 minutes for drinking water or milk. This is good alternative for the snack times. Also, you can use the quark, which is include the high protein. It's very popular now all around the world. But please choose the plain one, because on the markets you can see with apricot or strawberry or banana, but there also includes sugar. If you want to making a fruity quark, you should do your own quark and fruit. I want to use banana. Cut it. Banana, it's very easy for the mashing. And add to quark. The pre-diet period is like this. Everything should be soft. And now we can start to explain the solid diet period. We explained the liquid diet period and the pre-diet period. Now I want to explain the solid diet period. On your first month, you can start the solid diet period, but solid diet period, it's very similar with the puree. But now you don't need to blend it or mash it. Now you can cut with knife and fork and eat very slowly and good chewing. Good chewing is very important. If you feel after eating, if you feel bad things on your chest and also on your stomach, some crumbs, it shows us you eat big pieces, you eat very fastly, or you didn't chew it. So slow eating and good chewing, it's very important. Diet, it's little bit flexible. For example, now you can start to eat egg yellows too. You can make an omelette with the cheese or mushroom or some vegetables, but on the non-fat pan. But proteins are very important, especially at the morning. So please start your days with egg and cheese. At the lunch and the dinner, you should start with the chicken, fish, or meat first. But after then, you can start to eat yogurt or cooked vegetables a little bit. But you can't add to your meats or chicken or vegetables, tomato paste, onion, garlic, lemon, oil, nothing. Just salt for 3 months. But after 3 months, you can start to eat normal homemade meals. On your snack time, you can eat yogurt, or you can drink ayran, milk, or you can eat quark for the taking protein, and also you can eat fruits with biting. You don't need to mash it or blend it. And if you're a coffee lover, this is the good news for you. Now you can start to drink decaf coffee. But you should wait for the regular coffee 2 months more. But on your 3rd month, you can start drinking normal coffee. And for 2 months, all your drinks should be warm, not cold, not hot. And also, I want to say you something else. We will giving you the list, and there is lots of alternatives. You can select which you wanted. But you can't eat tomato, cucumber, nuts, bread, rice, and pasta. These are forbidden for first 3 months. But after then, you can start to eat a little bit tomato, cucumber, raw vegetables, or salad. But please wait for the eating bread, rice, pasta for becoming ideal weight. And I want to talk about the fizzy drinks. These are forbidden for the rest of your life, like sparkling water or Coke or Sprite, which is fizzy drinks. They are forbidden. Cause to be expand your stomach again, and you can gain weight again, and you should be very careful. We talk about all the diet programs after the bariatric surgeries, and if you are wondering about the nutrition, and if you did the operation, you can always ask from your WhatsApp group, which is we made us for you. Now I will answer the most curious questions. No, because it's the potato includes the high starch and high carb, and we don't recommend because it causes of the irregular blood sugar, and we don't recommend it. It's very normal because before the surgery your stomach stimulated the ghrelin hormone, and now you're feeling hungry because of this. But day by day it will be a decrease, and you feel more saturated every day much more saturated. Maybe it depends to patients to patients. Some patients the ghrelin hormone will go on 10 days, some patients in 5 days, but on the pre-diet period every hour patients feeling the saturated and appetiteless. Normally everybody needs to drink for 1 kg 30 milliliter, but now it's very difficult to catch this amount. But you should drink minimum 2 liters per day. You should try to drink more water. but day by day you can drink more water. On your first or second day, we will give to you the vitamin and minerals which you will use for 2 months. But after then, on your third month and 6th month, 9th month and 12th month, you will do your blood test and you will send us on your WhatsApp group and we will look your test results. If there is, for example, vitamin D deficiency, our doctors will say, okay, you should take a vitamin D. But you don't need to use multivitamin for a long time. Just we will give to you especially the vitamins which deficiency. You should drink still water because sparkling water has carbonated and it's caused to be expand your stomach again. On your liquid diet period, you can drink warm and light tea, but coffee is forbidden. On your first month, you can start to drink decaf coffee, but on your third month, you can start drink regular coffee. If you want to drink herbal tea, you can start drink herbal tea on your liquid diet, and you can drink linden or the chamomile tea. On the pre-diet period, every hour patients feeling like this: I can lose weight now. Is there a problem with my body? Why I can lose weight? Is there a problem with my body? But don't be panicked, because on the pre-diet period it's very normal. Your body trying to be adapted the new nutrition plans, and on the pre-diet period you are losing from fat, but you are regaining the water and muscle which you lost on the liquid diet periods. You can see the difference, but measure, we can see the difference from fat and regaining muscle and water. Don't be panic. If you feel stuck on your chest, it shows us 4 things. Maybe you ate a big portion at one time. Maybe you didn't chew a good, and maybe you eat very quickly. Maybe you ate so much. For avoid this stuck feeling, you should eat your meals very slowly and good chewing and very little portions. And when you feel saturated, stop. I tried to explain all the details of the after bariatric surgery nutrition. If you have any questions, you can always reach to us from our numbers, or you can comment this video. Bye bye.